Good morning, everyone. News out of Mexico from Reuters. Mexican doctor hospitalized after receiving COVID-19 vaccine. Mexican authorities say they are studying the case of a 32-year-old female doctor who was hospitalized after receiving the Pfizer-BioNTech COVID-19 vaccine. The doctor, whose name has not been released, was admitted to the intensive care unit of a public hospital in the northern state of Nuevo Leon, I think that's how you say that, after she experienced seizures, difficulty breathing, and a skin rash. The initial diagnosis is encephalitis. I've said that terribly wrong. But the health ministry said in a statement released on Friday night, that is an inflammation of the brain and spinal cord. The ministry added that the doctor had a history of allergic reaction and said there is no evidence from clinical trials that anyone has developed an inflammation of the brain after the vaccine's application. Pfizer and BioNTech could not immediately be reached for comment. Boss, you've got one here asking about encephalitis? Matitis? No, you don't want to answer that one? Okay. This one's about lunch on Thursday? Put that one through. Okay. Honestly, really? Couldn't be reached for comment, eh? Shocking. And I think that it's funny that you get one COVID test, in Canada, one positive COVID test in 28 days, and if you've got cancer or diabetes or heart disease, then COVID-19 is put down as the cause of death. But if you die, or if you were put in intensive care after taking the vaccine and having an allergic reaction and your brain and spinal cord inflame, that has nothing to do with the vaccine. There's no proof of that. Let's not jump to conclusions, eh? Everyone take that mandatory vaccine. Can't you see the case numbers are going up? We're going to talk about the case numbers going up in just a minute, but I want to show you this. An hour ago, the Ottawa Citizen posted, Ontario records another record-breaking day with 3,363 new cases. If the intervention that you're trying fails miserably, if you're BC and you have a carbon tax, say, and the goal of the tax is to remove carbon, but all it does is make things more expensive and it doesn't actually remove carbon, you should scrap the tax. If your goal of the lockdown is to reduce CO2 cases, yeah, they'll get there. They're working on it now. But if your goal of the lockdown is actually to decrease COVID cases, and it fails this miserably, change your tactic. Your lockdown isn't working, right? Locking down the general population with a test that's so flawed will never be successful. It will never be successful. It will never work. Ever, because the test doesn't work. It's flawed. Here's a pundit class and Donald Trump saying, please, where's the evidence that lockdowns work? Where's the evidence that lockdowns impact the numbers with regards to Toronto or Peel or York? They started their lockdown in October. They had November 11th was lockdown. Sorry, guys, 28 days. And then at the end of the 28 days, they were like, you know what? Nah, we're going to keep going. What are the success credentials? What are the success criteria? What are the success metrics that we're going to look for? Donald? What are they? What are we working for? These people have lost all credibility entirely, completely and utterly. Ottawa's public health officer, who would know Ottawa's situation, and the mayor have written to the province and said, like, guy, we don't need to do this. This is too much. The destruction of our community is happening because the destruction of the small businesses that make your community is happening. If your restaurant can't support the local ball team because they're bankrupt, your community is decimated. Why are we allowing these people to do this? This guy completely dismisses all of De Silva's and Mayor Watson, I think his name, Mayor somebody. I can't remember his name, I apologize. But I'm going to find it. It was Watson, but I said De Silva and I meant Etches, so I apologize, Dr. Etches. Regardless, here's the article. As Ontario reports more than 2,900 new cases, so this is a few days old, of COVID-19 for the first time ever, Eastern Ontario's top doctor suggests the numbers mean that COVID-19 lockdown will not end in 28 days. This is testing the water, floating a balloon. Public Health Ontario reported 2,923 cases of COVID-19 on Wednesday, including 64 cases in Ottawa and 16 in Eastern Ontario. That tells me that we still have a lot of work to do. It also tells me, again, that most of them are in Toronto, said Dr. Paul Romeolodis. Sorry, Eastern Ontario's medical officer of health. Just a quick aside, my brother makes fun of me at how badly we play NHL hockey on Xbox, and sometimes I'll just say the name of a player, and he just looks at me like, who? So it's not done on purpose. I get all the names wrong. Yesterday we were playing, I can't even remember the name I got wrong, but it was like awful. Anyway, back to this. The numbers are going up, he says. I think Dr. Romeo Torres. That was even worse. Anyway, doesn't matter. It does matter, but moving on. The numbers are going up. I think we need to continue doing what we're doing. Stay home. It's disappointing, but again, it's going to take a while for this thing to turn around, said Dr. Romulotis, noting the numbers do not reflect the start of the province-wide shutdown. Is a month enough? I'm not even sure now. News Talk 580's CFRA Leslie Roberts asked Dr. Romeo Lotus during Ottawa at work if the lockdown would be extended next month. In certain areas, yep, said Dr. Romeo Lotus. I think that's irresponsible, right? Like, this is a very cavalier attitude from somebody who doesn't understand what it takes to run a business and is destroying the community, culture, and social fabric of the province by being so cavalier about it. Really, honestly, that's how deep this goes. The Eastern Ontario Medical Officer of Health says there are several factors to consider when looking at extending the lockdown, including rate of growth, hospitalization rates, and the ability to do contact tracing. You know what we should be looking at? And I'm not a doctor, but here's what my opinion is. How many of these cases are actually symptomatic? What's the percentage? I want to know. And of those healthy people, how many of their contacts are sick? And if we don't know that, then what have we been doing for the last 10 months? What's the goal here? That's what I want to know. Not this BS. What they're doing is they're distracting us. And the next story I'm going to get to is not a distraction. We're getting into the numbers, but the travel story is a distraction. It's saying, hey, they're not abiding by their own lockdown rules. Of course they're not abiding by their own lockdown rules. This is a farce. This whole thing is a farce, and they know it. But they're traveling, and we can't. And the whole thing should be open us up. But what's going to happen is they're going to be locked down further. So the elite class is going to be even locked down a little bit further just to make up appearances so that we stay locked down. But they have absolutely no excuse for this. This is not borne out in the data. Back to the article. Quote, I can tell you that I don't see the numbers going down dramatically for at least another couple of weeks because Christmas, just because the volume of these numbers, said Dr. Romeo Lotus. Christmas numbers shouldn't be impacting yet. Right? And the lag in Ontario, the testing lag is such that these are last week's numbers anyway. This is before Christmas. Like, there's no possible way, I don't think anyway, that these are Christmas numbers on January 3rd, taking into consideration holidays that all of the health units have taken and the fact that there's the backlog at the Ontario labs. This guy is just spreading misinformation. And he totally dismisses the expertise of Mayor Watson and Dr. Etches, and I think that's irresponsible too. He's not the leadership in that area. Anyway, while 64 cases in Ottawa on Wednesday remains steady with previous days in the week, Dr. Romeo Lotus said that the COVID-19 wastewater levels are starting to go up. This tells us there's activity in the area. So they're, without your consent, monitoring wastewater to justify further lockdowns. This is absolutely abhorrent. Absolutely abhorrent. Unbelievable. Okay, here's the Bayes' theorem. The basic reason we get so many false positives to COVID-19. The disease is so rare that the number of false positives greatly outnumbers the people who truly have the disease. Here's the maths. And it goes through, suppose that you're worried that you might have a rare disease. You decide to get tested. Suppose the testing methods for the disease are correct 99% of the time. Suppose the disease is actually quite rare, occurring randomly in the general population, only 1 in every 10,000 people. If your test results come back positive, what are your chances that you actually have the disease? Less than 1% chance that you have the disease. Now, the basic reason we get such a surprising result is because the disease is so rare that the number of false positives greatly outnumbers the people who truly have the disease. Mass testing of the contagious virus was done to 1 million people, or say mass testing of the contagious virus was done to 1 million people. In that million, 100 will really have the disease. 99 will be correctly diagnosed as having it. 999,900 of the million will not have the disease, but of those, about 9,999 will be false positives. That's the Bayes' theorem. 1 in 2,000, including false positive, classifies COVID-19 as a rare disease in winter 2021. So that's 1 person in 2,000 people having the disease that classifies as a rare disease. And he references his own data here that prove that that's the rate of diseased people in the United Kingdom. Stefano Scoligo, Nobel Prize candidate in 2018, has calculated a real false positive rate of 95% from official Italian health service numbers. This is in line with Bayes' theorem as well. Calculation is in this thread, and you can check that out if you like. If we apply the 95% positive SCLEO back to England's positive test percent, including false positives of 0.05, we get a real percent positive in England of 0.0025 of the population, or 1 in 40,000 people. This would confirm COVID-19 as a rare disease as per Bayes' theorem. Try this calculator for up to 100 tests. So Bayes' theorem medical mass calculator test. Try it yourself to understand how many false positives you get by changing minor variables. Okay, so I used this. I think this one here. Flow positive rate. No, hold on. I'll show you which one I used. Okay, here it is. I'll read this. Severe COVID is a rare disease in England. If tests are 100% accurate, according to hospitalization numbers, it's 0.02, or 1 in 5,000 people, and that's according to this. And he says Bayes applied to LF tests, applied to this table, I believe. Lateral flow positive rate of 0.4 with sensitivity of 58 and specificity of 99.6 would mean that 100,000 people being tested would find 630 positives, of which only 230 would actually have COVID-19, while 400 would be false positives. So that's borne out in this. You can play with it for clinical probability. What's the chances of having it, test quality, and then sensitivity, and it gives you out of every 100 how many actually have the test versus how many false positive. Right? Very interesting calculator. This principle bears out, and he goes through to prove it mathematically further. In simple terms, when medical mass testing includes asymptomatic and the disease affects a minority of the population, a very small margin of error in the testing process will mathematically result in false positives being many times more than the real positives. Dr. Yaffe said exactly this I'll play it right now because she said this early on, and yet we're basing entire disastrous medical policy or dictatorship powers and policy based on these faulty conclusions because of the Breyer principle. Here it is.
And in fact, if you're testing in a population that doesn't have very much COVID, you'll get false positives almost half the time. That is, the person actually doesn't have COVID, they have something else, they may have nothing. So it will just complicate the picture. On the other hand...
So way more than 50% of the time, actually. And that's mathematically borne out in multiple data sets across different countries. Okay? So this is very, very problematic because we are definitely creating very draconian policies. Oh, that Dr. Tam talked about in a 2010 lead up to this. Here's Joe Warmington talking about this. If there are people who are non-compliant, and there are definitely laws and public health powers that can quarantine people in mandatory settings, so Dr. Theresa Tam in 2010, track people, put bracelets on their arms, have police ensure quarantine. Yeah. The NHS is canceling data. They're not going to be updating data because critical care bed capacity and urgent operations are canceled due to the coronavirus illness, COVID-19, and the need to release capacity across the NHS to support the response. We are pausing the collection and publication of these and some of our official statistics. This will apply to the release listed here. So they're canceling operations, they're lowering critical care capacity, and they're saying it's because of the lack of staffing. So lack of staffing they have the beds are physically in the buildings, but they're turning off the lights because they don't have anybody to staff it because they're testing positive. But back to mathematically many false positives when you test asymptomatic people. Should we reclass the test to only test people who have symptoms? Should we be driving an entire pandemic based on asymptomatic testing? Because that's what's happening. That is absolutely what's happening. They are locking us in our homes further for this. 5 days after strict lockdowns, Ontario reports 29 new 100 cases of COVID-19, right? Yeah, we've already talked about that. That was the further lockdowns. They're locking us down. Is this appropriate? Do they work? They don't work. Dr. Alan Proyer says, sick and tired of politicians telling us we have your back, we're in this together, and build back better. Show me your plan. Give me details. Where is the cost-benefit analysis? Where's the thought? Where's the substance? Until you can, STFU. Shut up. Yeah. Here's a growing list of Canadian politicians caught traveling during the pandemic. We're all in this together, but I'm going to go to Barbados. I saw an article today talking about how Justin Trudeau was in Barbados and he hired a Mexican hooker. And I thought, That's a bridge too far, everyone. That's a bridge too far. I mean, you know, I don't know. I don't think that Trudeau would need to hire anybody. I don't know, but maybe I'm wrong. Maybe being elite and living apart from your wife adds social complication. I guess you can't just go on Tinder and swipe right? Like, you know, it's not that easy, right? Anyway, regardless, there have been respectable journalists that say, no, Trudeau is at home at Harrington Cottage with his family for the holidays. He would not dare to be in Barbados, as is the rumor. Who knows? I don't know what's true. I've seen flight logs that don't have a from address or whatever. I don't have any proof that he's left the country, but who knows? But there are a lot of politicians who did leave the country. A lot of them, right? I'll show you. Hold on. And again, I think this is a distraction. I'm not going to go through these. I've talked about a lot of these before, but they have them listed by province, right? And then a big write-up for Ontario, because there's one in Ontario. Alberta has more. Manitoba's got a couple. Quebec has a couple. Saskatchewan has a couple. And there's more about this, but it's a distraction, right? New CBC has news that another Alberta MLA has been traveling, and another one went to Saskatchewan for Christmas. How dare they, right? But I think this is a distraction. I think that instead of arguing about our lost civil liberties, instead of arguing about the absolute complete destruction of our small businesses and the press, they're arguing over this garbage, right? Like, keep your eye on the ball, guys. We're losing our freedoms. We're losing our civil liberties. We're losing the thing that makes us Canadian. We're losing the ability to smile at our neighbors while we're in the grocery store, right? And go, oh my goodness, whatever's happening. I used to joke with people about Justin Trudeau, right? Like, you grab cheese and somebody would be thinking about the cheese, and you make some joke about Trudeau. Or I did. Maybe that was just me. And it changed more often than not. At the beginning, people would just kind of ignore you and shrug. But later on, people would joke back, and like, Trudeau is not well liked. And the Canadian experience is kind of joking about it, right? Like, oh man, isn't this awful? Like, oh, I wish everybody wasn't so crazy. But now people are openly hostile, right? And you know, honestly, sometimes they're openly hostile when they ask me to wear a mask or whatever. But then often, if I interact with them enough, because I go back to the same places a lot because they know me and they don't give me a hard time. But they're much more human with me than people who are wearing masks and are expecting me to wear a mask, right? It's very interesting. And it's interesting too to see the workarounds that people use for masks. Like, I've seen visors that are like not almost off, but you know, may as well be off. I've seen masks worn under the nose. Like, are people thinking that this is like just as good? The whole premise to me is you have to behave, like, you have to live like you believe. Like, you can't say, I believe I can walk on the water and then walk around the lake, right? Like, you have to live like you believe, right? And that was just off the top of my head. I couldn't think of another better obvious example. But if you believe it, then live it, right? So if you believe that COVID-19 and the tests are so flawed, et cetera, and there's no danger between masks or unmasks, and regardless of how prevalent and contagious COVID-19 is, the masks don't work either way, right? So to me, it's disingenuous to put it on unless somebody's asked me specifically, can you wear this mask for my health or my mental health or whatever, then I'll wear it for them. But like, if I'm going into a store, it's not happening. So anyway, I've gone off on a big tirade here, but regardless, I think that it's incredible how much we've lost, and the distractions that they're using to keep us from talking about it are notable, because it has nothing to do with, they traveled, yeah, get them to comply with the rules that they're setting. Yeah, I mean, sure, they should, but we should have a discussion around why they're not complying with the rules that they're setting. And that should be driving it. And we should be having a cost-benefit analysis of the lockdowns versus no lockdowns versus being able to open up again. And we should be comparing to the last 5-year average, because the last 5-year average is very indicative. I've shown charts before, and I guess I'll show it again right now, because why not? That show the ICU average over the last few years is normal. I added a search to Canada Poly, so yeah, that's good. Here's the original source of that. So yeah, if you want to do research or whatever, I think that I'm trying to make it easier to use for research. I use it for my research, but you can use it for your research if you want. The search helps, I think. But this is the original source of the ICU data, and the ICU data clearly says we're at 80% capacity as of December 10th or December 16th, right? I mean, how are we in a disaster? What's the emergency? Can you please define the emergency? I've looked at the reopening Ontario Act and all sorts of stuff. And what it says is terrifying. And there are distractions. These are distractions. The travel stuff is distraction. It's a distraction to keep us from talking about the important things that are being taken from us. Travelers must take a COVID-19 test before flying to Canada. Here's what you need to know. I've heard speculation this is completely illegal anyway. And if you don't have that test, then you have to go to one of the isolation centers that they built. Yay, right? This is a completely manufactured crisis. Completely manufactured. We're cutting off our leg because our toe hurts a bit. Like, forget sprained ankle. Our toe hurts a bit, and we're halfway through cutting off our leg. Canada might offer holiday travelers a relief benefit. So for those who qualify, what they're trying to do is the federal government is looking into whether travelers who went abroad during the holiday and who will miss work in order to self-isolate should be eligible for pandemic relief benefits. I went on holiday. I made a choice to go on holiday, and now I have to quarantine when I get back. But please give me $500 from taxpayers that are going to pay it back years later. This is just unbelievable. For 8 months, Randy Hillier says, I've spoken against exaggerated COVID risk. I've greeted and embraced thousands of people in my home, the legislature, and rallies. I've never come across anyone sick with COVID. How serious is COVID? This week will be more parties at my house. Ontario Poly and wearing, we are living a lie. And yeah, I mean, things are crazy. Look at this. Did you watch this video? Here's the CTV News article. 6 people were in a home, so 6 police came to attend that home, and for your health and safety, they pulled that guy out in his sweater and arrested 2 people who were released at the scene and fined $1,200. This is, I hope they're just sued. I hope they're sued. And don't sue them for violating your basic rights, because they'll say there was an emergency, your basic rights needed violating in order to protect your safety. We're going to come into your home and pull you out of your home during your gathering, and for your safety, arrest you and fine you. And then have a good night. See you guys later. Protect and serve. Right? Yeah, right. So how is that for your health and safety? These people should be sued, but don't sue them for violating your rights. Sue them for to prove where the emergency is. What's the emergency? And here's the data. Last 5 years, where's the emergency? Right? Where's the emergency? Liars. Absolute liars. But the emergency is in the loss of our civil liberties and our loss of our civil rights, and the ability for 6 police officers to attend a gathering of 6 people in a private home with no warrant and to pull people out of their house and arrest them. Unbelievable. That's what's going on. Unbelievable. Welcome to Canada. Calgary, they're protesting. And you know, to me, I watched the Yellow Vest protest for years before this was even part of it. And they just ignored them. And that was enough to bring down governments. If that was a conservative government, if that was a government like that Le Pen had been heading, that would have brought that government down. The Arab Spring, right? I don't know. But at some point, the people are being ignored. And it's being purposely done. This is Toronto. 2 protests got together and started chanting freedom. That's pretty crazy. But it's being ignored. It's being completely ignored. Where in the opening Ontario Act? So kids are supposed to go back to school on tomorrow, but they're supposed to go on the online learning, which is garbage. I haven't seen any comparison between for a K-6 or an under grade 8 to do online learning, and yet they're forcing everybody to be experimented on with this online learning. Where does the data go? How are these teachers not concerned they're just going to be replaced with playlists, which is, economically feasible? If they can just declare some businesses non-essential, how long before they declare teachers not essential? Oh, we got this playlist here, and we're the Board of Education. We own it. We know you produced it, Mr. Jennings, but unfortunately for you, we own it. So you're fired, and we'll have your lessons running for the next 5 years, and then when we find a better lesson, we'll replace that with that. And there you go. Royalties. What royalties? Ha. This is unbelievable. So anyway, Anthony Fury says kids don't vote. They don't have lobbyists, but they still deserve a voice. Ontario parents need to speak up now if they don't want schools kept shut. I'm not participating in the online learning. I've told them under no circumstances. And somebody asked me, one of my family members asked me, what's the difference between, I said, no, I said, she'll not have unsupervised time with the teacher under any circumstances, no. And somebody said, why? And I said, what's the difference between that and one-on-one time at school? I said, at school, they're not recording the interaction. At school, they're not potentially storing that recording of the interaction on cloud servers in who knows where. Google cloud servers. Where does Google have their cloud servers? Do you know which country your schools using and which country the data is stored in? I don't. And because I don't, I have no idea what they're doing with it. I've heard unbelievable and plausible things that talk about how AIs are trained. I know that Google's working on AIs. What if the data is being used to more easily control a population across ages, right? How to easily control children and mold them into high social credit scoring adults, right? And I'm sorry that I don't ascribe to any of this. And not to say sorry, but I don't ascribe to any of this crap. And that often causes friction with certain people, not certain people in my day-to-day life, but occasionally through, things that I have to do in interactions through day-to-day, because I don't want to play the game. And you have to live like you believe it, right? Like you have to live like you believe it. And so when people talk about the value of falling in line with the crowd, I rage against that, because the value of falling in line with the crowd is not questioning why everybody's standing there doing a Nazi salute, is not saying, this feels different than it did. This feels different than it did. This feels different than it did. And we need people to stand up and say that. And the more people who, maybe they're jarred by my approach, maybe they don't like that I refuse to agree that wearing a mask is a good idea, if it helps one person. Because, there's a lot of businesses that have gone under trying to help just one person. There's a lot of people who've been really impacted by the inability to have social interactions being normal. There's a lot of people who saw their last Christmas in an isolation house, in a room in an old age home, who are never going to see their grandkids again because they're worried that they're so sick or that the grandkids are going to get them sick. This is an evil thing to do to people. This is evil. This is absolutely, it's so sad. And how do you fight it? Because the people believe it. The more and they're preloaded with the talking points against it, right? They're preloaded to disbelieve it. Oh, you're a right-wing white supremacist. Okay, sure. You want to believe that? All right, sure. But it's just an unbelievable attack. Why would you let your children be experimented on? Why would you let your children be the first to try this? Why would you think that it's a good idea? Just because the computer's been so good to you? Because the Twitter and the Google and the Facebook, they've been so fair and balanced with your free speech and your data? You think that? Frustrating, right? It's frustrating. And I'm sure that there are things that I think that frustrate other people, I'm sure. I know there are, but whatever. Regardless. It's crazy. It's crazy. This place is crazy. Ontario, the world is crazy. This is, as of September 8th, 2020, Ontario is pausing any further loosening of public health measures or reopening business facilities or organizations. I didn't know about any of this. Most emergency orders are currently in force until July 29th, 2020. What are they using to facilitate all of these closures? Where in the Reopening Ontario Act does it say we can unilaterally close schools and experiment on your children by sending them to online schools that have never been tested apples to apples against brick and mortar classroom schools? Right? Where are the unions on this? Where are the unions saying, oh yeah, our teachers are fine with working online, no problem. You want to be recorded all day? Okay. You want all of our data to go through Google? Okay. Insanity. It's just complete insanity. And the news is talking about MLAs who are traveling. Oh no, they're traveling. Masks for cows aimed to filter burps to curb emissions. Greenhouse gas emissions. This is the most important thing. You know what we need to do? We need to cut off the oxygen supply of milk and meat producing mammals. That's what we need to do. The poor cows. These people are insane. Like, just even if a year ago, if somebody had suggested this, can you imagine a year and a half ago, before this COVID madness hit, if somebody said, you know what we got to do? We got to get cows outfitted with masks. The farmer would hit you. They just be, shut up, like, you moron. Get out of here. Like, nobody would publish this garbage. What absolute tripe. What absolute garbage. This is a sad story. This is out of the United Kingdom. This is the last one for today. This gentleman's losing his mom, and so remember death panels? Remember in the United States, death panels, 2008, they're coming for your doctors, your death panels. That was a big argument in even 2004, I think. 2004, George Bush used it as a wedge as well. And so the UK government has said, this guy's mom is sick. He brought her into the hospital, and they said, well, she's only got a 5% chance of living, so we're not going to give her care. And they're just refusing to give care. And I mean, they're a socialized system. It's not like he can say, okay, well, I'm going to take her out of your care and take her to somebody who will provide her care. They're just not going to give her care. They're just going to Keep her in the hospital until she either gets better or dies. So, I mean, it's a very sad situation. And one that I fear is the longer we tolerate this garbage, them telling us that they need to lock us down when the reality of the 5-year average is that we are absolutely in line and actually better off because of the increase in beds in Canada, in Ontario. And when you look at all of that, how are they justifying the continued fear-mongering? It is nothing but fear-mongering. And when you look at the response, the one response we have is lockdowns. The one response we have is lockdowns, and they'll just find somebody who agrees with lockdowns enthusiastically. Is there a chance we might get a lockdown? In certain areas, yep, you betcha. Don't you love being locked down? Everybody loves the lockdown. This guy is just like, they'll find somebody to push their agenda. They will find people to say this is the healthy way to do it. Well, once you've lived your usefulness, your mom's quite old, right? But don't worry, says Katie Telford to Jody Wilson-Raybould when she's got concerns about the legality of using her Attorney General position to give SNC-Lavalin a DPA, Deferred Prosecution Agreement. Don't worry, we'll just have a whole bunch of op-eds written to back you up, right? No problem. It doesn't matter how ridiculous they are either. People will just eat it up. They'll believe it. No problem. Don't worry about it. And what mechanisms are we using? Oh, well. We'll backfill the laws to back up the bad policy decisions. And they're not using any data to justify any of this. None. No data. When they, because I feel like it's inevitable, when they extend this 28-day lockdown for the province, when they put final nails in the coffins of large and small businesses across the province, when they do that, they will still not produce one shred of data. And they will do it with impunity, and they will not care about the people who are screaming about the loss of our culture and the loss of our economy and the loss of our social cohesion and the loss of what makes us who we are, both culturally in the short community sense of things like Guelph and Mississauga and Toronto and all of its positives and negatives, right? All the things that make those places where they are, Kitchener-Waterloo, right? All of those things are gone because they're being destroyed by bad policy without data to back it up. That's where we are. Welcome to 2021. Wake up if you're not awake already. Things are not great, and they're not going to get better if we do nothing. Call your MP, call your MPP, be a pain in the ass. I don't know any other way. I don't know anything else to do. Thanks for watching, everyone. Check out CanadaPoly.com, check out SpeakingMoistly.co, check out CanadaReport.co, and have a wonderful, wonderful